Hello, my name is Vincent Maksymowski, and I'll be presenting with Laurence, the use of dexmedetomidine compared to opioids in maintaining hemodynamic stability in patients undergoing carotid endarterectomy. Introduction background. This systematic review was conducted to evaluate the hemodynamic stability of dexmedetomidine while being used as an adjunct for means of sedation and analgesia compared to opioids. Patients undergoing CEA experience hemodynamic instability from inadequate pain management and sedation, thus posing a risk for intraoperative and postoperative complications. Some important factors include maintaining normotensive arterial blood pressure results in adequate cerebral perfusion, decrease the development of postoperative hematomas. Challenges are met when traditional treatment of using fentanyl, midazolam, and/or propofol because these conventional therapies often lead to hypotension, crisis, and postoperative nausea and vomiting. In general anesthesia, hypotensive episodes occur in the intraoperative phase, while hypertension occurs in the postoperative phase. On the other hand, during regional anesthesia, hypertensive episodes tend to occur during cross-clamping and hypotension after clamp removal and crossing over to postoperative phase. Dex offers an effective adjunct for analgesia and sedation, thus promoting hemodynamic stability without causing respiratory depression. Relevant literature. Funk's model of research utilization integrates the use of DEX into clinical practice. Based on published research and surveys regarding the use of DEX as an adjunct of pharmacological approach, the assessments for research quality aids nurse anesthesiologists in decision-making processes of whether the drug will promote hemodynamic stability. After identifying the quality of research, clear communication throughout the delineation of anesthetic considerations of DEX can be attained by conducting research with measurable outcomes. Such outcomes are further analyzed for research quality and literature review. In the early 2000s, the United States Food and Drug Administration researched and authorized the properties of DEX as an analgesic and sedative adjunct during the perioperative phase. Compared with the traditional therapies of opioids, benzodiazepines, and volatile anesthetics, DEX allows for hemodynamic stability while also offering patient sedation and pain management without risk of respiratory depression. Funk's model of research utilization provides a systematic framework that encourages the evaluation of quality evidence and enables research dissemination during research utilization. Problem statement objectives. Hemodynamic instability results from inadequate pain management and sedation for patients undergoing carotid endarterectomies, can affect neurological assessments and delay recovery. Current pharmacological interventions of opioid use is being utilized to control hemodynamics. However, opioids' effectiveness for constantly preventing hemodynamic fluctuation will remain questionable. Opioid dosage use must be administered carefully as it has major respiratory depression effects and may cause emergent airway interventions if not dosed appropriately. Therefore, the objective of this systematic review was to perform exhaustive literature research regarding the use of DEX as an analgesic adjunct to maintain hemodynamic stability through the perioperative phase. Criteria for studies in this review. The systematic review was undertaken to address the following PICO question. In adult patients undergoing a carotid endarterectomy, how does using dexmedetomidine as an analgesic adjunct compared to opioids in maintaining hemodynamic stability perioperatively? Our patient population or problem were adults undergoing carotid endarterectomies. Our intervention was dexmedetomidine, our comparison was opioids, and our outcome was hemodynamic stability. Underneath, you can see the selected appropriate words that we were used to research for studies regarding this information. Search strategies. Two doctoral nurse and anesthesia students conducted a thorough literature search in September 2023 to gather systematic review studies on the use of DEX as an analgesic adjunct versus opioids in maintaining hemodynamic stability during carotid endarterectomies in adult patients. They utilized multiple databases, including Medline, Complete, Cochrane database of systematic reviews, Prospero, JBI, evidence synthesis, and DARE, along with advanced search strategies and Sinol, Complete, Embas, Ovid, Medline, Cochrane Central Registration of Randomized Control Trials, and ProQuest. Various search terms are employed to identify articles focusing on adult CEA patients, DEX interventions, and comparisons with opioids, as well as outcomes related to hemodynamic stability. They consulted with a university librarian to refine search terms and strategies, and ultimately identify 503 articles after removing duplicates. These articles underwent screening for inclusion and exclusion criteria. Literary selection: a Prisma diagram, or a preferred reporting items for systematic reviews and meta-analysis flow diagram, was used to screen studies for various databases for relevance to the topic. Out of 503 articles initially screened based on titles and abstracts, 488 were excluded for being unrelated to the research question. That focused on articles concerning the use of DEX as an analgesic adjunct in maintaining hemodynamic stability during carotid endarterectomies. After collaborative screening, 11 articles were deemed irrelevant to the PICO criteria. The remaining 4 articles underwent further evaluation based on relevance and critical appraisals using the Jonas-Briggs Institution checklist for randomized controlled trials. One article was excluded after being thoroughly reviewed. Following discussion and consultation, 3 articles were selected for inclusion in the final systematic review. The Prisma diagram facilitated a systematic selection process, ultimately leading to the inclusion of these 3 articles.
Results and discussion. Findings show that patients undergoing carotid endarterectomy with regional anesthesia and dexmedetomidine use resulted in fewer antihypertensive treatment perioperatively, decreased plasma norepinephrine concentrations, and fewer analgesic needs. On the other hand, patients undergoing carotid endarterectomy with general anesthesia and dexmedetomidine use resulted in significantly lower nicardipine dosage use after extubation, lower plasma norepinephrine concentrations, and lower postoperative verbal analog scale scores at PACU stay after 0 hours, 1 hour, and 3 hours. The authors concluded that using dexmedetomidine promoted hemodynamic stability for patients undergoing carotid endarterectomy in general and regional anesthesia. Becker and colleagues and McCutcheon and colleagues found that dexmedetomidine promoted normotensive arterial blood pressures with regional anesthesia in intraoperative and postoperative phases. Also, Tsujikawa and Nikeshita concluded that dexmedetomidine used as an analgesic adjunct with general anesthesia lowered plasma norepinephrine levels and decreased the use of nicardipine dosing during the postoperative phase. The systematic review concludes that the use of dexmedetomidine promotes hemodynamic stability in patients undergoing carotid endarterectomy. However, this systematic review would further benefit from conducting studies with larger sample sizes containing a diverse population in order to promote generalizability. Limitations. The research conducted by Becker and colleagues is a single-center study with a small sample size. Also, the use of vasoactive agents in addition to dexmedetomidine during carotid endarterectomy may affect the accurate interpretation of results. Moreover, McCutcheon and colleagues needed a larger sample size to promote the validity of differences between the dexmedetomidine group and the standard group with regard to cardiovascular or neurologic events. Tsujikawa and Nikeshita had similar limitations. Their study was single-centered and had a small sample size. Also, nicardipine dosing varied among participants, which can skew results. The strengths of the studies reviewed include being a level 2 on the hierarchical scale of evidence. This level of evidence is supported by the research conducted as randomized double-blind controlled studies, therefore supporting generalizability without confounding factors that can affect the validity of the studies. Furthermore, sealed envelopes, and unlabeled syringes were utilized to promote blinding and randomization. Reliable tools that promote quantitative measurements such as 12-lead EKGs, baseline blood pressure and heart rate measurements, and catecholamine plasma levels were assessed. Lastly, studies were conducted in different countries including Australia, Japan, and the United States. There were multiple challenges faced in the studies that could ultimately affect blood pressure and heart rate in the participants undergoing carotid endarterectomy. One of them is the lack of anesthetic provider skills that could lead to a failed cervical blockade with regional anesthesia. Anatomic differences also add to the challenges faced by the anesthetic provider. The various locations of carotid atheroma could further complicate the surgery, as evidenced by technical difficulty faced by the surgeon due to difficult access to high carotid lesions. The author's recommendations for using dexmedetomidine as an analgesic adjunct for adult patients undergoing carotid endarterectomy stem from dexmedetomidine's sympatholytic properties. Becker and colleagues and McCutcheon and colleagues found that using dexmedetomidine with regional anesthesia resulted in fewer hemodynamic fluctuations, a titratable level of sedation that limits oversedation and respiratory depression, and effective analgesia that decrease postoperative pain medicine requirements. As for dexmedetomidine with general anesthesia, Sujikawa and Nikeshita found that dexmedetomidine provided smooth emergence and recovery that maintained baseline arterial blood pressure and heart rate within normal range, and lower plasma norepinephrine levels and nicardipine dosage used. Implications for practice. The investigators of the systematic review concluded that new practice guidelines with the use of dexmedetomidine are an acceptable analgesic adjunct during carotid endarterectomy, as evidenced by an exhaustive literature review of the studies. Current findings from the three research studies support effective analgesia, desirable sedation, and less hemodynamic fluctuations. The investigators of the systematic review suggest the following implications for research: a larger sample size, various patient population that includes multiple patient comorbidities, geographical location, determining a standard dose for loading and maintenance infusion rates of dexmedetomidine doses with the goal of decreased hypotensive and bradycardic episodes in the post-operative care unit, and more randomized, multi-centered trials, double-blinded techniques with a placebo and a control group in comparison to the treatment group. These are our references. Thank you for listening and have a good day.